Welcome, everyone. We have an eye-opening statistic to start today's program with, something everyone should know, and that is that poisoning is the #1 cause of injury-related death in the U.S. And here in Tennessee, it is problematic as well. Joining us today to talk about it is Josephine Darwin. She is the Director of Community Outreach from Tennessee Poison Center. We're so glad you're with us.
Thank you.
Thanks for being here. For folks out there who might not be familiar with the Poison Center, talk a little bit about it, what you all do over there.
Okay. Tennessee Poison Center is a comprehensive poison resource center that's based at Vanderbilt University Medical Center here in Nashville. But it does serve every single resident in all 95 counties. And we're the only poison control center in Tennessee. And the programs that we provide to everyone from the youngest child to the oldest adult are the Poison Help Hotline, which is what we're known for, and that's a toll-free medical hotline for poison emergency and information calls, and that number is 1-800-222-1222, lots of twos in there. And we also provide poison prevention education, and we also provide, this is something that people do not know the Poison Center does, 24-hour surveillance for chemical or biological terrorism for every county.
And so that's something that, you know, our nation's capital is aware of, obviously, whatever's going on here in our state.
Right, and that is why the 1-800-222-1222 number was first started by Congress in 2001, and that's one number that everyone in the United States can call to get their local poison control center. If we ever do have any kind of disaster, then everyone will call that number to get decontamination information and information on what to do in case of emergency. But mostly, everyday emergencies is what we deal with.
All right. Well, let's talk specifically about that hotline, Josephine, because a lot of people might be familiar with it. For those who don't, we'll be putting it up throughout this program. But let's talk about who they are talking with on the other line. Are these volunteers? You had said medical staff, so let's talk specifically about that.
Okay. A lot of people feel that the Poison Center are volunteers, maybe medical professionals, but volunteers who come in and answer the calls, but only very qualified medical professionals who've had extensive poison management experience can answer the hotline. And these are full-time staff of the Poison Center, not volunteers. And you have to be a registered pharmacist, a nurse, or a physician to answer the calls. All of the specialists that we have right now are pharmacists and nurses, and we do have one physician, and then we have a board-certified medical physician toxicologist who provides medical backup 24/7.
Okay, and talk a little bit, if you will, about the number of calls that are received on the hotline, and if there's a reason maybe why they peak in volume or not, whether it be summertime or something like that.
Well, last year we had over 50,000 initial calls. Our specialists answer between 150 and 200 calls every day. From all 95 counties. We made about 49,000 calls to monitor the patient to try to keep them at home rather than them having to go to emergency rooms. So when someone calls the Poison Center, they'll get one of our specialists, they'll evaluate the situation, and then in 68% of the time, they will tell the person first aid treatment recommendations to do over the phone so they don't have to go to a hospital or to a physician's office. And that not only will save a lot of lives, but it also saves a lot of money.
Sure. When we're talking about specifically who is making these phone calls, or maybe who the victim might be, do you all monitor in terms of we have more children that we treat and help, we have more adults, and who would that be? Who is the primary victim?
Well, the most likely poison victims are, of course, children, especially children under 5, because they're exploring everything, and if parents don't put things up in a high locked cabinet or in a container where children can't get it, then they're bound to do that. So around 58% of our calls are for the accidental poisoning of children. But teens and young adults are the ones that are most likely to die from poisoning. And not only is poisoning the leading cause of injury death in the U.S., it's also the leading cause of injury death here in Tennessee, above motor vehicle accidents, gunshots, wounds, and drownings.
All right. Let's talk also specifically about the nature of the calls. Would you say the majority of them are serious? Are they emergency type situations? Or do people call really for information if something's ingested and, you know, they're able to maintain some calmness and get through it?
Well, the one thing that we recommend is that if you think you have an emergency, if you think somebody's been poisoned, to call the Poison Center first. Call the Poison Center first before you do anything. Don't call, if you call a pediatrician, they're going to tell you to call the Poison Center. But do that first, and then we'll tell you if there's a problem. as I said, about 68% of our calls were managed at home, so we were able to keep the patients at home. But if we do feel like you need to go to a hospital emergency room, we will refer you there. We'll call the hospital and tell them what to expect, and then we follow up with the patients at the hospitals also.
Oh, very good.
And that brings up something. It's not just the public that calls us, but hospitals all over Tennessee call us also.
Really?
Emergency room or emergency medicine physicians are experts at a lot of things, but we are the absolute experts in poisoning.
Sure.
So if they have a overdose patient, someone who might have taken a lot of different poisons, then they will call the poison center for protocols and what they should do for those patients.
Wow. You touched on this just a little bit, Josephine, but tell us what the most common causes are of poisonings.
The most common is pain medicines. That's the most common thing that we have. Also, household cleaners. That's always a big thing. Cosmetic and personal care products, not only with children, but we've had a lot of adults who've brushed their teeth with hemorrhoid cream, thinking that it was toothpaste. So
really?
we have a lot of different
accidental
things.
type scenarios.
Yes,
Yeah.
so many different things. We have plants. You know, that's another big one, especially in the springtime when. That includes pesticides, when people start putting pesticides out.
Makes sense.
So every type of poisoning we deal with.
Okay, let's talk about the prevention of this, because obviously, as you said, some of these things are going to be accidental. Some people, have chemicals in their household that, other members of the family may not be aware of too.
Right.
So how do we prevent poisonings from happening?
Well, the most important thing is to have the number for the poison center available and in your cell phone. A lot of people might have our stickers or magnets, but right now the one thing that most people have with them all the time is that cell phone. And so we want you to put the number, the 1-800-222-1222 in your cell phone. Also, anything that's a potential poison should be, if you have children that come into your house, should be in a high locked cabinet. That's one of the most important things to do, especially medicines. When we were talking about peak calls, our calls always go up around Thanksgiving, Christmas, holidays when children might be visiting grandparents.
Yes, extra family members are in the house.
And they
That's
have
right.
not put up their medicines. If you have caregivers in the house, you need to be sure that they're aware of poison prevention tips. Also, a lot of people will poison-proof the inside of their house, but they forget about the garage. There are a lot of very poisonous things in the garage that go in cars, car additives, gasoline, things like that.
And jars of liquid that aren't even labeled sometimes,
yes.
I think, in
and
a lot of
that's
people's
another very important thing, is always keep everything in its original container. Don't take it out of a container. People now are buying a lot of products in big, like at Costco, Walmart, the big box stores, and putting them in smaller containers because they're easier to handle. That's really a dangerous thing to do. We get calls every single day about children drinking cleaners, and even worse, because things were put into a container that wasn't the original one.
Yeah. For young folks out there who might be watching this, what would you say to them, one of the most important things about chemicals in general?
The most important thing is to always ask first before you eat or drink anything. I do a lot of poison prevention programs to children, and that's the one thing we say, is always ask first. And that's also, we have adults who will drink bleach or things like that have been putting glasses on a kitchen table thinking that it's, a soft drink or something. So, really ask first is the most important rule.
Great. Josephine Darwin, thank you so much for your time from Tennessee Poison Center. We appreciate it.